overall. Up to this point in the pandemic, we've had 573 deaths. There are currently 37 people hospitalized in the health district, and there are 26 outbreaks. Just to place the deaths in context, there were about 600 deaths in Ontario for car crash deaths in any given year. And since the pandemic in Windsor-Essex, which has approximately 430,000 people, there have been about 573 deaths. So the number of deaths attributed to COVID is many times what you might see in a typical year for car crashes. Although a significant number of those deaths are people perhaps in the twilight of their life, there are also many people in the prime of their life who have succumbed to COVID, and it still remains an important public health concern. The province has promulgated a number of relaxations, some which took place today, and some which will take place on March 1st. I think at this point in the pandemic, we have to monitor what the burden of disease is in the community and continue to effectuate our plan. The local health district's plan is guided by provincial direction and provincial guidance documents, but it's also modified and modulated by the local epidemiology of the health district itself. I think it's fair to say that Windsor-Essex has suffered disproportionately from COVID-19 compared to other health districts in the province. Whenever we consider risk, one way to characterize risk is what is the risk of the population. So there are, talking to the epidemiologist, there are 430,000 people in Windsor-Essex. 183,000 of those people, approximately 183,000 of those people have received 3 doses of vaccine. So those people are, I would say, maximally or optimally protected from COVID-19. 78,000 do not have any vaccine at all. Of those 78,000, approximately 18,000 are children under the age of 5, and they're ineligible for the vaccine at the current time. And 50,000 are people who are adults and who have yet not been vaccinated. So the remaining 155,000 is predominantly people who have 2 doses of the vaccine. And the reason that's important is that most of those people who are vaccinated with 2 doses received their second doses in late summer last year, so August, September. And as time progresses, the vaccine becomes less effective. And at least one rule of thumb is, 4 months, 5 months after injection of the one loses the strength of the vaccine or the vaccine immunity. Now, these numbers have to be modulated by the fact that some people in the unvaccinated group or in the 2 vaccine group have developed COVID and therefore have some level of immunity. However, the level of immunity with infection is probably less robust and lasts a shorter period of time than with the vaccine itself. So it's a complicated story, and the science is still evolving. But bottom line is that as we move forward in the pandemic, we have tens of thousands of people that are susceptible or not optimally protected, and maybe even in the 6 figures. So that weighs on our risk as we move forward. And one core message I would have is those people who have not received their boosters to get their boosters, those people who have not been vaccinated to get vaccinated for their first, to start their primary series. The second item that I think as we move forward is that we have to follow the metrics, and the metrics that we have currently available to us are, for the most part, lagging indicators. That is hospitalization, ICU admission, death. And lagging indicators mean that that it's sometime after the fact that we know about those data elements. I just share with you, death is always a challenging indicator from a public health point of view, because it's hard to interpret. Although we know who died, which is in itself a verifiable data element, when the person actually, at what point in time does death capture the public health measures? So, meaning this, if a person were to be exposed to COVID today, it would be a couple of days before they become clinically infected and have symptoms. It could be a couple of days, it could be up to 10 days. Once one gets clinically ill, it might be 1 day, 2 day, or 3 days. I'd hazard to say a few days before the person, on average, might make their way to the hospital. And I received some information from my colleague today. For an ICU patient, the typical time between hospital admission and death is 12 days. So the death numbers we're seeing today, which are at a nadir in these past few days, may reflect the suite of public health measures that happened a few days ago, or it could represent the suite of measures that were in effect a few weeks ago. Now, one could do more sophisticated modeling, but that is just one of the challenges with interpreting the elements that we have at the current time. My feeling is this: as we move forward, one is, and I mentioned it previously, we have to monitor the effect of these relaxations. But also, I think we need a dialogue about what normalization means. COVID is not likely to be eradicated in the near or intermediate term. And normalization means a suite of items that we have to consider. Among them, it's likely that we're going to have to add hospital capacity and/or prioritize who goes to the hospital and gets treatment. We're going to have to consider where masks fit into our management plan. We have to think of a vaccination perhaps as a regular, maybe semi-annual or annual event. We'll have to think of where social distancing is and probably have to continue with some component of that. And we'll have to consider the fact that we'll have to purchase medications in society as medications become available and the indications for those drugs become more broadly available. But the final thing I would close with is it's likely that we're going to have a modulation of disease activity. And we'll probably have times when we have lower disease activity and we may have one set of interventions, and then we may have times of other disease activity and we'll have to have maybe a broader group of interventions. It's always hard to predict the future, but I think that it's worthwhile for all of us to consider how we develop, how we reach a new sense of normal in our community. Thank you so much for allowing me to share my comments, and I'm happy to answer any questions.
All right, thank you, Dr. Nezatiri. Any questions or comments? Yeah, go ahead, Judy.
Thank you, Dr. Nezatiri. So one of the things I'm wondering about is as we open up, and many of us have had our third boosters and we're encouraging people to get their third boosters, I feel like the population that has been vaccinated is getting booster weary. And can you speak to a little bit about this type of vaccine versus the flu vaccine and why so many boosters have been necessary and may continue to be necessary semi-annually or otherwise?
Well, I think that the level of immunity that is provided by the vaccine wanes or reduces over time, and the additional vaccination or the booster vaccination provides enhanced immunity for a person who might be exposed. I think a lot of things about COVID still we'll be learning more about. It's a new disease. It's a new group of management strategies, and we'll be learning more about what the optimal interval for booster and vaccines are. Yeah, I'm always reluctant to predict the future, but my guess is that, or my sense is that, with the mRNA technology, that we'll be able to develop more tailored booster vaccines depending on the actual variant that people might be exposed to. Now that happens with the flu vaccine as well, because it's targeted towards certain strains, and there's a complicated algorithm to determine what strains are covered in different flu seasons. And I get the sense that that's probably going to be what happens with the COVID-19 vaccine as well. And I'm also hopeful that we'll have new classes of medications that'll be readily available to help mitigate the symptoms in the future as well.
Thank you.
All right, any further questions or comments? Hearing none, then a motion to receive Dr. Nezatiri's report. Judy? Joe?
You must not have seen my hand there, Chair.
Oh, sorry, Gary.
Yeah, not a problem. Thanks, Dr. Nezatiri, for always being with us. Appreciate it. Doctor, a couple interesting announcements last week from Queen's Park, the Ontario government there, about new Ontario health teams for Windsor-Essex. So can you expand on that a little? As what does that mean for us moving forward in a vaccination standpoint and also as a health unit standpoint? Do you have any information that you could provide us?
Because Nicole is more involved with that, perhaps I can ask her to comment first and then I'll supplement that. Would that be okay?
Thank you.
So I'll speak maybe just to our involvement in the Ontario Health Team. So as you know, we had a really exciting announcement that we have an approved Ontario Health Team for Windsor-Essex. And I'm not the spokesperson for that health team. I believe that honor is right now Claudia Denvor and Bruce Crowder, Chief Crowder from EMS. But we do, I'm the representative on there's the steering committee for the Ontario Health Team. And again, we're just at the point now that we have that official approval where we're redefining and reestablishing some of those partnership tables for different sectors. And so there'll be more information I'll be able to bring forward, or we will be able to bring forward to the board as that work evolves. But, it really is more focused on the health, not necessarily public health, but it's more focused on the health sector and delivery and coordination of services. But we're, we are part of that steering committee.
If I could supplement as well, as we organize health services, I think the three domains that are particular importance are access, so that people can actually get treatment in a timely manner, quality of care, and patient satisfaction. And I think that formulating health teams will, and my hope, and I think it will help improve all three of those important domains in improving health.
I appreciate that, Dr. and Nicole, and probably a little bit too soon to see exactly what's going to happen, but it's nice to hear you're encouraged by by the move forward here. So thank you, Chair.
Okay, thank you, Gary. Any further questions or comments to the report? It's been duly moved and supported. All in favor? Opposed, if any? That is carried. Thank you. All right, we did approve the minutes 6.1. Is there any business arising from the minutes? There's none. Consent agenda. We have the consent agenda before you, and it's 8.1 to 8.3-2. And if I can have a motion to receive the consent agenda. Gary and Ed, all in favor? Opposed, if any? That is carried. Now, I should ask if there's anything out of those reports that the directors would want to, to bring us up to date. Nicole?
Yeah, I just want to highlight 8.3 is resolution and recommendation reports. So we'll speak to those items.
Okay.
Just try to find it in the package. I'm not sure it does not identify the page that it's on. So there's a recommendation for the CTS report. So as the board is aware, you have approved us to move forward with establishing a CTS for Windsor-Essex. And we did receive approval from the City of Windsor to move forward with a location at 628 Goyu. We have had our legal counsel work on a lease agreement that was built upon the term sheet that we originally had established with the landlord. And so the recommendation or the resolution you have before you is for us to, for that permission to move forward with the lease and negotiate a lease with the landlord.
Okay. Board's pleasure. We need
So moved.
resolution. Thank you, Reno. And do I support? Aldo? Any questions or comments? Hearing none, all in favor? Opposed, if any, that is carried. Thank you. I'm wondering, Lori, if you want to make a comment on the amendments to the 22 budget submission.
Yeah.
Just
Yeah, absolutely. I can share my.
on page
screen. I'm
21,
just
I think, your agenda package.
I think it's, yeah, page 23, I can see on my PDF. So hold on, I'm just going to share my screen. So as discussed in the January board meeting, in Nicole's operational update, we talked about several changes that had occurred because of announcements associated with vaccination. More specifically, we talked about the redeployment of nursing staff and administrative staff to support vaccination, establishing a mass vaccination site in Leamington, and redeployment of other staff to support case and contact management as well as outbreaks. We are in the process of preparing our annual service plan and budget submission to the Ministry of Health. That is due on March 1st. What we wanted to do is include, because of this new information, we wanted to include additional provisions to account for estimated expenditures for the 2022 budget year in regards to the efforts to focus on vaccination efforts from January to March, but also looking at that time frame beyond March and any immunization efforts associated with the 0 to 4 age group. We have compiled an estimate of those expenditures. The total estimated expenditures for the 2022 year in above and beyond what was presented in November of 2021 is $1,907,007. Salaries being the largest proportion of those costs. This budget amendment proposes to cover the costs of certain staff that were assigned to other programs funded by other funding envelopes, more specifically the Ministry of Children, Community and Social Services. And as well, it contemplates additional FTE supports to support immunization efforts for the remainder of 2022, roughly 15 FTEs. Additionally, there's some other supporting operating costs such as mileage and program expenditures that we envision will be incurred on account of vaccination efforts for the balance of the year. So we're bringing forward a motion to yourselves today to approve this amendment. This amendment will go forward in our annual service plan submission and will represent additional one-time 100% funded asks from the Ministry of Health, and it does not have any implications for the contributions to the obligated municipalities. So the motion is as it's presented on the screen right now. Does anyone have, through the chair, if there's any questions? I'm happy to go through them right now.
All right, thank you, Lori. Any questions or comments to Lori? If not, then I need a resolution on, if you could take the your shared screen off.
Absolutely.
Good, now I can see folks. Moved by, you got a question or moving it? Moving it. Thank you, Reno, and our support. Aldo? Any further questions or comments? Hearing none. All in favor? Opposed, if any? That is carried. Thank you. New business, 9.1 Project Governance Committee update, both Judy and Nicole.
I think Nicole is going to bring the slides up. So the Project Governance Committee has met several times. And so, as you know, the process began in 2016 because the current lease is ending in 2023. The committee was reconvened in the fall, and there was asked for mapping for the ideal location to be renewed because some of the changes over the last year and some of the timelines and milestones have been renewed and updated.
You can keep going. Sorry, Judy. There you go.
So we are in phase one, where we are looking at the space needs and selecting our consulting partners. In RFQ for the space needs assessment, we awarded it to Architectura. They were the firm who did the original space needs assessment. So they were able to provide an updated assessment based on changes. There's been a number of changes. The concept of what type of space we're going to need based since COVID, work share, increased dental programs, some other things. So they took all those things and met with the leadership and came back to the Project Governance Committee. We also are looking for a project manager, and responses were due the end of January. We're now evaluating the proposals, negotiating the contract, and we'll be looking at procurement by March the 7th. So phase two will start March 2022 through August 2022. We'll be looking at going through the site selection process, looking for expression of interest to build to suit or renovate the office space. We'll be looking at that this spring. We will be evaluating those and looking for approval by the Project Governance Committee in June and July of this year, and coming back to the board with recommendations in July, and to the subsequently the obligated municipalities approximately around August 2022. It's a tight time frame, but the staff are confident and the Project Governance Committee is confident that we can meet the timelines. Phase 3 will start in September through October, September this year through October next year, with the new location design and fit and fit, where we negotiate the lease with the landlord, approve the conceptual designs and floor plan, either new construction or retrofit. We look at a dual location operating plan. We develop the service level reduction plan, procurements for furniture, moving and equipment, that type of service to happen through later next year. And as we move into phase 4 at the end of next year, and the next slide, when we'll be moving, fun time to move from August right through Christmas, moving furniture and equipment to the new location, new building orientation, safety instructions, and operating some simulations and rehearsals for the clinics, so that the plan will be up and running. And in the board package was a timeline summary. Again, the times are tight, but expected to be able to meet all the requirements as we move along. So if you have any questions, do we need a motion on this, Nicole? Or it's for information?
Just to receive, just for information.
Yeah, motion to receive. Any questions or comments? And a motion to receive the report as presented. Fabio and Gary? All in favor? Opposed, if any? That's carried. 9.2, this the City of Windsor, the Auditor General request. Nicole?
So in your package, we did receive a request. We have received this in the past through the board. This was presented to the executive committee, and the recommendation is to decline, to respond to decline. We do have our own auditor, and so we do go through audit as well as we're subject to the provincial audits, and both program-based, but also health. There's the ministry does health unit audits as well. And so at this time, we would recommend to decline the offer.
Okay. Questions or comments? Hearing none, a motion to support the administration. Is that a question first?
Chair, if
Yeah.
I may, just and I'll support the recommendation, but I just wanted to provide context. That letter was sent out, and perhaps Councillor Kaczek or Sleeman or Bordelin could provide additional insight. Just for context, it was resolution at council to all of our boards and committees. So it wasn't targeting the health unit per se. It was sent out to everyone. But again, I recognize we have layers of accountability and auditing that Ms. Dupuy mentioned. So I'll support the administrative recommendation, but I want to emphasize that it wasn't to target the health unit, that this was sent out to everybody.
All right, thanks, Bob, for the clarification. Then Joe, you moved the report.
I support Nicole's recommendation. Just a question perhaps, and I know we do get this, I sit on the Conservation Authority and it's a similar request. My question maybe for the City of Windsor, maybe if they could go back and ask, you know, since this is an annual thing, can they not, how do you say it, do not call list? I want to say, you know, do not send list, because the health unit, unless we change our position, it's going to be the same answer year after year. And it seems like we're just, you know, correspondence, wasting everybody's time. And then the same thing with IRCA. They're not interested. They have their own governance and their own accountability. And so I just turn it back to see if that's something administratively that they can address and say, look, when we do send it out, the health unit, and I know IRCA, it's the same answer year after year. So just to maybe a question that if it could be brought back to the administration at the city.
Well, I'll leave that to our colleagues from the city.
Through you, Mr. Chair, we could include, I mean, we can include that in the response that, you know, I mean, I guess that there's not a need to bring it back, that we, and we could include that in the letter of response if that is the board's desire.
Yeah, and you know, at the end of the day, we're subject to the Auditor General from the province of Ontario, and they do spot checks on health units throughout, and really, I mean, the province is you know, the 50% you know, commitment that they, or the 75%, sorry, and then we're challenged with 25%, both the city and the county. So it doesn't really make, there's a lot of redundancy that certainly be added there, and for that. Reno?
Yeah, just to add context, I mean, to Councillor Bacchetti's question, the administration sets the audit plans for about a 4 or 5 year window. So this was a political decision that requested this. So administratively, we do set the audit plans generally for the 4 or 5 year plan. So once you're asked, if you're not in that window, you wouldn't be asked again, except until the politicians get involved and want to ask. So, but I love the idea of a do not revisit list.
So basically, just send a response, Nicole, basically, and just to further add that the, you know, it'd be actually redundancy. It doesn't make much sense, like, for us, and And to Reno's point, at some point in time, hopefully it'll fall off the list.
Okay.
We're saving the city money by not adding to the auditor's work.
4 hours.
So anyway, well, I don't want to get into semantics, but I would say if I could have a motion then just to basically support the administration. Reno, and supported by Judy. All in favor? Opposed, if any, that is carried. Thank you. Vaccine planning update. Christy?
Okay, I'm going to share my screen. Okay, hopefully that's clear for everyone. You can see my slides?
Yep.
So we wanted to just give you a quick update around our vaccination planning for 2022. Certainly COVID-19 continues to be a vaccine that we are heavily supporting here at the health unit. We do want to spend a little time just touching on some of the other vaccination priorities that we have from a public health perspective and talk a little bit about what we foresee for the next 6 or 7 months and potentially beyond. So in terms of vaccination priorities right now, for COVID-19, the focus for the month of February has been the age group of 5 to 11s. Currently in Windsor-Essex, our rate is sitting around 43.5% for first doses for the 5 to 11 group, so certainly below the provincial rate target, which is 70%. For the month of February, we've done a number of items, including communications. We've had some targeted vaccination clinics in schools and community. We've adjusted hours in the mass vaccination sites to accommodate those families, including weekends as well. We have 39 pharmacies in Windsor-Essex County providing vaccinations to this 5 to 11 group. It is a different vaccine altogether from the adult Pfizer. So we have 39. In total, we have approximately about 105 pharmacies providing COVID vaccine, but only 39 are providing the 5 to 11 specifically. I'm happy to report, and this number keeps going up, but we have over 20 school clinics planned between the end of February and through the month of March in both elementary and secondary schools. And that continues to be a pretty important channel right now that we're seeing for vaccination uptake, in particular for this group. An overall sort of summary about vaccine access points, in particular for COVID-19 over the next few months. This is just sort of a nice progression you'll see as we look to really consolidate, recognizing the mass vaccination sites are not meant to be long-term fixtures within the community, and certainly we'll capitalize on the other outlets that we have for the vaccine strategy. So as everyone's probably aware, the Nature Fresh site was closed on February 5th, and we transitioned our health unit staff over to a Grovedale Clinic site in the town of Kingsville. We took that over from our Crest partners, and we've been supporting, in addition to public access through walk-in or appointments, we've also been supporting agri-food in terms of booking group appointments for any of their temporary foreign workers. So that's been an ongoing process and has been, a very important element to the strategy so far. The city obviously still has our Sears vaccine site, which everyone probably has either seen or visited. Hotel du Grace Healthcare has also been operating a site. They've reduced their cadence to about 2 days a week just based on volumes, but certainly continue to be a great access point for the West End. As I mentioned, we have about over 100 pharmacies participating in the COVID-19 vaccine rollout. We have approximately 55 healthcare providers that are actively or have actively in the recent past provided COVID-19 vaccinations. Unfortunately, that rate has slowed down pretty significantly over the course of about the last 6 months. So that's a channel that we continue to work on engagement. And, our mobile strategy, which, was probably the most crucial element right now in terms of rollout. So the health unit has a pretty robust mobile strategy with a number of teams that go out on a day-to-day basis to provide mobile clinics and pop-up sites, as some people refer to them. And our partners at Crest, which is the combination of Erie Shores and EMS, continue to offer mobile clinics as well on an as-available basis. As we move into the month of March, you're going to see some changes The Sears site is going to remain open for COVID vaccinations on a much smaller capacity. We'll still be working in partnership with Windsor Regional Hospital at the site, but we'll also be extending what's offered in terms of vaccination at the site to include some of the Immunization of School Pupils Act vaccination. So it's going to be our catch-up site as we try and sort of expand and reach some of those students that we haven't missed. And we'll talk a little bit about that in the next slide. We'll continue with pharmacies and healthcare providers, and of course our mobile strategy. Looking into April and beyond, we will see a closure of our mass sites, including the Devonshire Mall site. So a real emphasis on some of those grassroots strategies as we look at our mobile strategy continuing to be one of the most important pillars, as well as our pharmacies and healthcare providers. So in terms of COVID-19, what's sort of next and what's pending, right now, as of tomorrow, individuals who are ages of 12 to 17 will be eligible 6 months post their second dose for a booster shot, so that we have communications prepared, and that will launch tomorrow across the province. Vaccine approvals, which everyone's probably seen or read about in the news, are still pending, certainly. At an earliest, the estimated time we expect to potentially see movement there would be around the end of Q2. A lot still to be determined. So in terms of thinking ahead, looking at this age group, who would be the bulk of first doses as we move through the coming months. So it's really going to be a focus on that healthcare provider administration strategy. This is an age group, of course, that we know often frequents healthcare providers, are comfortable receiving immunizations from their healthcare providers. And it's also, I think, worth noting, as we look at many parallels as we move forward with the COVID rollout to our influenza vaccine rollout. This particular age group will be really important for us to work with our local healthcare providers on, because this isn't an age group that normally would seek vaccinations as an example of pharmacy. So I just put an example for influenza. Individuals aged 6 months to 2 years would have to visit their healthcare provider. So it'll be a really important time for us to engage that community and really sort of look towards planning and strategizing to target that age group upon those vaccine approvals. So in terms of our Immunization of School Pupils Act overdue vaccinations, this is a little bit of a snapshot, really with an emphasis on some of those key target birth years that are out of date. So the total right now is really around 8,000. There are more individuals likely between the grades 7 to 12 that are also overdue. But really, from a targeted strategy perspective, it would be these 3 birth years we're focused on. The 2004 birth year, so these are our grade 12 students right now that are out of date, those 1,900. They're really important for us to support as a community, because they will age out of eligibility to be able to receive these vaccines for free. So we've got some real targeted strategies to try and encourage those folks to contact their healthcare providers or come visit us for a catch-up appointment in the coming month. So our catch-up plan, as I mentioned, we're going to co-locate this particular activity at the Sears site, which is a great site with support of our Windsor Regional Hospital partners as an ongoing activity. So we're going to sort of close the site for a few days and reopen on Tuesday, March the 8th. And at that point, it'll be a dual offer clinic. We'll be running on Tuesday through Saturdays. We'll also be back in the schools in the month of May, those high-risk schools we visited in the fall, to provide those individuals with second doses. We'll also be offering additional community catch-up clinics for these vaccines, really starting from April all the way through the summer. We continue to offer in-house appointments for individuals as well, if they're not interested in a mass vaccination site or they don't have a healthcare provider. And again, we continue to support any healthcare provider in our community that's looking to provide these vaccines to their clients that are eligible from these birth cohorts. And we do that and provide it for free of charge. So again, our catch-up plan, there's a lot of course, record review involved in this. Our website continues to be available. We encourage all parents to update their child's records online. One of the things we'll need to talk about in the coming months and really look at is our sort of suspension process and timeline. If you'll all recall, pre-pandemic, we were on the eve of supporting a suspension in our elementary school level. COVID, of course, made some changes to that when we came back from March break, so that was put on hold. So certainly revisiting that, it's an important element and a requirement for us to do as a health unit. And really, with a sort of energetic and enthusiastic strategy towards catching these students up, we do have the potential to be able to get ourselves back on track and hopefully start the 2022-2023 school year and really start to see some semblance of number, in particular for those grade 7 groups that we normally offer a regular cadence of first and second doses to during one school calendar year. So that is really the end of my slides for today. So happy to take any questions.
Okay, thank you, Christy. I believe Judy.
Yeah, Christy, could you bring up the second slide? And first of all, I want to commend you on the plan to be juggling so many different levels at once and the confidence to bring all of this back up. I do have a question, however, though, and to the administration and maybe to Dr. Necessary with respect to the second doses and some third doses and that to the children. I totally support the vaccine and all the efforts we do. My concern is having children between the ages of 11 and 16 vaccinated without actually having permission or some type of formal permission from their parents. So I know that we undertook some of that in the fall. We were educating kids. I just wanted to have a little discussion here about, because most of the vaccines, or when my kids were in school, parents had to sign off for all of the vaccines for children under 16. And so this to me is just taking this in a step that I think we're setting a precedent, and I'm just a little concerned about that. And I wondered if we could speak to that at all.
So I just want to clarify, Judy, you're asking around the consent process for individuals over 12?
Over 12 and under, yes.
Okay.
So 16 and under.
And I don't know,
Sorry,
Dr.
12 to 16, sorry.
Maybe I'll ask Dr. Necessary to start, and we can certainly add to that.
Sure. So I don't know the intricate processes of the Windsor-Essex Health District, so maybe I could speak more to my general belief. The issue of consent is a complicated one in medicine, it really is not defined by any one age per se, but rather about the person served's ability to understand the risk versus the benefits of treatment and to make a decision about any particular treatment. That being said, as a father of 3 children, I want to be involved in the decisions that my kids might make for their health. And so I think that's the natural balance, that's the natural tension that we all face. All of us who have children have that balancing challenge. My preference is always for young people to have dialogue with their parents and make decisions about their clinical care with some level of collaboration and input from their parents. Now, the process by which vaccine is effectuated in Windsor-Essex, and Nicole can comment on a bit further, but I do want to share with you it's a natural and entirely normal tension that parents and families have, and I'd always try to encourage people and young people to include their families in their decision making. Now, in certain areas of health that's more delicate than others, like contraception, where we struggle with on one level wanting to provide that important service so long as the person can understand the risks and benefits of that. So, sorry for that sort of complicated answer, but Nicole, maybe you could supplement my comments.
Yeah, so there is no age of consent in the Healthcare Consent Act. So it is up to the practitioner to determine of any age of any individual that they're able to consent and that they understand, they have that informed consent and they understand the healthcare services and treatment that are provided. We're not alone, Judy. So just so we're clear, all health units, provide the same messaging as well as the ministry as it relates to the rollout of vaccination to that 12 to 17 age group. I think our practice has been we encourage certainly parents to be present. We encourage that youth have that conversation with their parent or a trusted adult, beforehand. And but they are, as long as the practitioner believes that they are able, to consent, they are able to consent for their own healthcare services, and that would include vaccination. It's this isn't specific to COVID. In the past as well, if we're delivering services, we wouldn't refuse healthcare services to to a young person who has consented for themselves. And it certainly is, appreciate the challenging topic right now. All of our school-based clinics are after hours. So there really is an opportunity where we hope that there's that, it's more flexible being after hours for families, but not every young person has that same, they'll make the decisions for themselves as an individual. But and Christy can certainly add to that.
Okay, thank you.
Okay. Any further questions or comments on Christy's report? And then if we can have a motion to receive the report as presented. Reno, thank you. Ed, thanks. All in favor? Opposed, if any, that is carried. 9.4 Alpha Winter Symposium. And I believe that's held on February 25th, 2022.
So, yep, just the information about the symposium is there. I think you could still, members who are interested could certainly still register. We do have a few of our board members attending, and as well as a few members of administration. So just highlighting the opportunity for members of the board. And if you are interested in, let Leanne know, and we can get you registered.
Okay.
It's open until tomorrow.
Till tomorrow. Thank you again. So if you're wanting to attend, either get flip an email to Leanne and to get you registered. Okay, that's for information there. Okay, we'll move on to item 10, which is correspondence. I believe we've got 10 pieces of correspondence. Start off by asking if I have a motion to receive the correspondence. Gary, thank you. Reno, on the receipt, all in favor? Opposed, if any, it's carried. Is there any pieces of the information that members want to bring forward? Okay. Then we'll move on to, we've done the committee of the whole, members of council. Our next meeting will be held on March 24th. I think it's moved back a week because of the March break. And as a matter of fact, it'd be St. Patrick's Day. And as a good Irishman, I think we'd have a problem. So I think I'd have to relinquish that to the vice chair. So actually, we did not move it because of me. So I'll say. So stay tuned. That'll be by video, by the way. And okay, so then nothing further. I think adjournment's in order. Moved by Reno and supported by Gary. All in favor? Opposed, if any, that's carried. Thank you very much, members of the board. And I think for those going to IRCA, I think we might have we're just a little over the wire. So with that, I bid you certainly good afternoon. Stay safe and stay off the roads. It doesn't look pretty good out there. So until next time, we'll see you.